Pensioner Clifton Wilson unhappy with the treatment from SZV. SZV launches dedicated webpage for adjusted procedures. But first up, the 8 ministers of the NA-UP coalition to be sworn in tomorrow, March 28, 2020. Those are the headlines for Friday, March 27, 2020. This is SXM Daily News. I'm Valerie Van Putten. Now for the details. The 8 ministers in the NA-UP coalition government will be taking the oath of office tomorrow, Saturday, March 28, 2020. The swearing-in ceremony is scheduled to be held at the governor's cabinet on Saturday at 11 a.m., to be followed by the constitutional meeting at the same venue. The new ministers are from the National Alliance: Prime Minister Sylvia Jacobs, Minister of Finance Adwell Irion, Minister of Justice Anna Richardson, Minister of Romy Egbert J. Doran, Minister of Education, Youth Affairs and Sports Dr. Randers Rodolph Samuel, Minister of Plenipotentiary Renee Violinis, and TEAT Minister Ludmila De Wever of the UP. PJD2 Newsroom spoke to the Honorable Prime Minister Sylvia Jacobs, who was responsible for the formation process.
On Monday, I handed in my formation report, the final report. Yesterday, I had to provide some supplemental information, and the date for swearing in was set for Saturday morning.
Saturday, at what time?
At 11.
How many candidate ministers will be sworn in on Saturday, Prime Minister?
There will be 8 ministers sworn in on Saturday, and I will be able to send you those names in writing later today.
What provision is being made, if any, to accommodate family members who might want to attend the swearing-in ceremony?
Unfortunately, due to the COVID situation and our social distancing regulations, no family and friends will be able to take part, as the facilities at the governor's cabinet is quite small, and we'll be doing our constituting meeting right there as well, to avoid too much back and forth or interaction.
So you're saying that the constituting meeting will not be held at the government building as usual, but at the governor's mansion office?
At the governor's cabinet, yes. In the conference room at the governor's cabinet. Usually we do the swearing in, then we sign the declarations, the national decrees, and then we go to the government building to have the constituting meeting. Because of our COVID situation, again, we are avoiding too much back and forth.
In her national address, Prime Minister Sylvia Jacobs has reiterated that the public stay at home. According to the Prime Minister, the police force of St. Martin, along with their French counterparts, will enforce the restricted movement of persons to avoid the further spread of COVID-19 virus. She further stated that persons have to be in possession of a document that authorizes them to travel in and around the Dutch and French side of the island.
The police force of St. Martin is coordinating controls together with their French counterparts starting tomorrow, Friday, March 27, 2020, in order to enforce the restricted movement of persons, which has been implemented as a preventative measure on St. Martin and Saint Martin to avoid the further spread of COVID-19 virus. Controls have been ongoing by the French gendarmes to inhibit unnecessary movement on French St. Martin. The restrictions require all persons to be in possession of a document that authorizes them to travel in and around French St. and even to the Dutch side, and defines whether it is work-related or related to an urgent matter, which should not exceed more than 1 hour. This restriction applies to French citizens who work or live on the Dutch side, as well as Dutch citizens who work or live on the French side. Seeing the spread of the virus has increased drastically on French St. Martin in the past few days, and local transmission is highly likely, Dutch residents are strongly advised not to venture to the French side unless strictly necessary for work purposes or in case of emergencies. While this may seem restrictive to us as St. Martiners, as culturally many families have ties between both sides, This measure is for your own health and safety, and the health and safety of your family and the rest of the community. For the past few weeks, we have been asking for persons to heighten their awareness of ways to mitigate the spread of COVID-19. We have stressed on the practice of proper hygiene, enforce school closures, place restrictions on non-essential businesses, and minimize business hours, all with the intention to minimize movement of you, the people, and therefore minimize the spread of COVID-19. While no curfew currently exists prohibiting movement of the population, each and every citizen is asked to stay at home as much as possible in order to keep yourself and your loved ones safe. The police force has commended and continues to commend, along with me, all our citizens and business community for your compliant behavior thus far throughout this process, and I encourage you to comply with these latest measures as well. Those not following the direct instructions by police who do see you on the road with unnecessary business will be asked to return to your homes. And if you do not listen, you will be fined according to Article 3 of the General Police Ordinance. CPS and our healthcare system, while doing their utmost to serve the people of St. Martin, remain at limited capacity, which will not be able to sustain a major outbreak if persons continue to go about their lives as usual. Persons who have traveled within the past 3 weeks should have registered with CPS by now by dialing 914 and should be at this moment in self-quarantine without symptoms but having that travel history. That's what self-quarantine means. Persons who have a family member who has traveled in the past 3 weeks in their home should also be self-quarantined even if you have no symptoms. You should not be going to work or venturing out into the community as well. If you feel that you must be doing these things, then that person that has traveled should be in isolation, meaning separated from the family. Persons who have flu-like symptoms but no travel history are not automatically considered suspect COVID-19 patients, but they should also self-isolate at home and stay away from their family in order to not spread whatever they may have to their family members. These persons should also monitor their symptoms in case they may have been exposed to someone who has traveled. All of the above-mentioned persons should contact CPS dialing 914 or their house doctor for information as to whether they should be tested. CPS nurses are currently monitoring over 450 people who are either in quarantine without any symptoms or in isolation having some symptoms but maybe not necessarily travel history, and only those who meet both the travel history profile as well as having flu-like symptoms will be tested right away.
And in other news at this time, Friendside police officers have arrested a male suspect who was involved in a fatal shooting outside the Market Garden supermarket on Sunday, March 22, 2020. Police spokesman Inspector Josefa confirmed the arrest and also thanked the public for its input in this investigation, as well as the Special Robbery Unit, which was busy nonstop with this investigation since Sunday. And still to come, President of the Windward Island Teachers Union feels the teachers were discriminated against. I'll have the details of that story and more when SXM News returns.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Megawati is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
And as we continue now with the news, Social and Health Insurances, SZV, has launched a dedicated webpage for adjusted SZV procedures in light of the coronavirus COVID-19 pandemic. The transition to online services was made to contribute to the public health and safety of residents. In an exclusive interview with SXM Daily News, we spoke with the Chief Customer Officer at SZV, Mrs. Parveen Butcher, who says that the move was to remove the need of customers having to visit SZV offices and make services flexible to maintain access to health care and other benefits.
This page is designed to keep updated on the most important and most accurate information from SZV. So we have designed this to support the exchange of transparent information to customers and the public. This dedicated COVID-19 webpage on szv.sx is providing an overview of all the adjusted procedures that are applicable to SZV. The website can be found on the main menu of szv.sx. There's a red text box, so you cannot miss it. I encourage everyone to visit this webpage for updated SZV procedures, or send us a message on Facebook, or call us during opening hours. Our opening hours are Monday to Friday from 7:30 a.m. until 2 p.m. If you have original documents that are required for service, you can always drop these off in the Dropbox offices at our SZV main office. The Dropbox offices are checked on a daily basis, and confirmations are emailed or called to the customers. I would also like to take a moment to thank the dedicated staff and stakeholders, such as healthcare providers, banks, and governmental departments, which have made it possible to fast-track the implementation of many online procedures. SZV would also like to thank its customers for making good use of the online and phone services. Please also, you and your family stay safe and continue to practice preventative measures and follow government guidelines.
And President of the Windward Islands Teachers Union, Mrs. Claire Elshot, is furious, indicating the discriminatory measures that have been taken with the teachers, that schools were canceled for 2 weeks. However, the Minister of Education sent a communication that teachers should be in school from the 18th to the 25th of March. The president feels that the teachers found themselves in an awkward position as they had to bring their children to work. She felt that the teachers were definitely discriminated against.
In addition to that, we have noted through press conferences that our minister became a minister of tours. The prime minister is a minister of tours. We saw how she diligently toured the airport, then she toured another facility, etc. She was then in the role of making sure that everything is all right. It was very disappointing, though, to see that a minister, prime minister, that was a former educator, never toured none of the facilities for education to make sure that everything was being done in the right way and everything was actually, according to the standards. So internationally, we have seen that we lost a teacher, we lost a principal to the corona disease already on the international level. God forbid, I hope that we don't have to experience that in St. Martin. But I'm saying, why do we continue to, expose a certain group of workers, yes, to that risk, while another group not? Because in the meantime, we notice there is a list of non-essential businesses under which the schools fall under that. But still, the contradiction is that schools, the teachers have to be in the schools. Okay? And then the essential businesses and the police are policing, as we have been told, to make sure that a certain amount of persons are in there, that the people adhere to cleanliness, because, of course, people are using in supermarkets, they're using gloves, and then when you look at the gloves, they are so dirty that you're wondering what kind of effect that would have. You know, you can see the dirt through the gloves. So it is something that here in St. Martin, we are still wondering and trying to figure out why certain things are being done the way. Without the implementation, it looks as if social dialogue is no longer the honor of the day. We have all kind of ways of communicating now, you know, WhatsApp, teleconferencing, etc. But it is as if intentionally the unions are being left out of certain deliberations.
And now turning to our weather forecast for March the 27th, 2020. Despite the presence of a low-level trough, shower activity will remain limited across the local region. Additionally, the weak Atlantic high-pressure system and the resultant loose pressure gradient will maintain a light to gentle breeze. Seas will remain slight to moderate during the next few days. Now, let's turn to your 3-day forecast. And still to come, member of the anti-poverty platform unhappy with response time of SZV. I'll have the details of that story and more when SXM Daily News returns.
Make use of WIB mobile banking with easy access and direct usage of face recognition, PIN code, or fingerprint. Download WIB mobile banking app and make your transaction from anywhere at any time. For more information, visit wib-bank.net/quick-login.
Member of the anti-poverty platform, Dr. Anders Raymond Gisseroen, feels that SZV is taking too long to address complaints concerning Medicosmetics, a company that provides diabetic supplies to seniors. Mr. Gisseroen says that seniors with a diabetic condition can no longer go to pharmacies on the island. He expounds.
SZV taking too long to address complaints concerning Medicosmetics. Seniors with a diabetic condition have been complaining about the supplies and services that SZV has contracted from a company, Medicosmetics, in Colby. Since October 2019, diabetic persons are no longer allowed to go to pharmacies in St. Martin to get diabetic materials as an SZV insured. Seniors who were accustomed to get their strips for their glucose meter via the pharmacies now have to get approval from SZV to get their medical diabetic prescriptions from Medicosmetics in Colby. Transportation problems for seniors to reach Medicosmetics in Colby, and also, more importantly, faulty test equipment have been reported to SZV, but still no adequate solution has been offered. In our meeting with management of SZV last year, we understood that SZV, to save money, has granted this company an exclusive contract to provide medical supplies to all patients insured with SZV. But what we cannot understand is that the quality of the supplies, even though they are cheaper for SZV, they are substandard and not durable for the clients, which in the end will cost SZV much more money. Individual seniors have complained with SZV, and even a reporter of a local newspaper interviewed and wrote about the complaints of seniors with diabetic conditions. You can read this in the Daily Herald of Saturday, January the 11th, 2020 on page number 4, under the title, Diabetic Pensioners Frustrated with New Process for Medical Aid Supplies. In this article, even the communication officer from SZV was quoted to say that SZV was aware of the complaints of the seniors. So what we cannot understand is that we also have brought these complaints to the attention of SZV since last year, November. And all we get is this answer, that it has the attention of management and that we will be notified as soon as management has taken a decision.
And pensioner Mr. Clifton Wilson, meanwhile, says that this has been going on since October. He approached the ombudsman, who told him to send a letter to SZV, which he did. He was promised an answer, but nothing to date. Mr. Wilson said all he can say that it is ridiculous with the ways that they are being treated.
As you read in the email that I sent to them, it's been going on. I mean, I'm surprised it went on since October. I knew about it since February. And like my doctor said, I took the test at the lab, we saw the results, and I thought, okay, all we have to do is just simply give us equipment that will work for us. Well, I sent the email, and I got a response that said it would be passed on to someone else to contact me, and that person contacted me. I complained because at the window I was told that they are looking into getting new equipment. And then the email that I got told me the same thing. So I'm back to square one. And I just think it is, I could only put it as ridiculous, the way we are being treated. Now, I went to the ombudsman to get advice, and she suggested I send the email. I did that. And now what I did also is I sent it to the chairperson of the Health Committee in Parliament, Mr. Omar Otley, and I hope that I'll have a response from him, and I hope that Parliament would impress upon government that somebody has to let SZV know that we are customers, we are paying customers, well, we've paid already, and we deserve, decent service. So just now, I got my new strips, so I can use that, and I can measure my glucose every day. What about the people who cannot afford it? Because a lot of times, some people may say, well, because I can take care of myself, we forget the rest. Well, I cannot do that. So I'm speaking out because a lot of us need that assistance. Well, this one here is the Freestyler. That's the model of it. And the pen you see here for the Lance, this is for this one. I just used one pen right now. But this Freestyler, this works. Okay, and I can say it worked because when I took the test at the lab, when I measured with this, it said 120, and the lab results were 122. Now this one that says perfect 3, I would want to say it's probably a third rate to perfection, because this does not work. The readings on this go from anywhere between 40 points to 33 points in difference between what you read on this and what you read on the Freestyler. So I don't know what people that are, let's say, diabetics that use insulin, I don't know if they adjust their dosage based on the reading. But if they do, they could probably overdose themselves thinking that they've got a higher reading than it really is. Now, if nobody thinks that that is serious, I have difficulty with those who think it's not serious.
And as of today, Friday, the Simpson Bay Bridge will now open twice a day. The bridge will open at 9 a.m. for inbound and outbound traffic, and then again at 2 p.m. for inbound, outbound traffic. The Causeway Bridge opening will be synchronized based on the Simpson Bay Bridge openings. This will be coordinated with Mariners by calling the VHF 12 channel. And still to come, the St. Martin Bankers Association announces new banking hours. And I'll have the details to that story and more when SXM Daily News returns.
this morning?
Good. So, Rebecca, thank you for coming. I work as a psychologist at the Mental Health Foundation. I mainly see children and adolescents, but I also see adults.
So whenever there's a crowd, that's when you're starting to feel
nervous.
Okay.
Nauseous.
Okay. It is kind of like your body. We are so used to taking care of our body. If we have a little ache in our foot, we know to rest it. We know, okay, I might have walked too much, so I need to rest. Now, of course, that can be just an ache in my foot, but I can also break my leg. Now, for breaking my leg, I would have to go to the doctor. So that kind of goes the same for mental health illnesses. So you can come in for something little as, I'm really stressed out lately. What would you need? A little bit of rest. But someone can also come in with way more difficulties. We're not here to judge right or wrong, good or bad. Is it helpful for you? Fine. Is it not helpful for you? Okay, then let's see what we can do about it. But not a wrong nor right, absolutely not. It's a magnifying glass without judgment.
Well, there's still a lot of stigma on the island, unfortunately. It's not a topic that people easily talk about, and that's a shame. They're afraid that they get judged, and there is still quite a bit of judgment. I mean, often we hear, don't go to that crazy house. Once you go in, you never go back. And it's just not true, We treat a lot of patients here, and a lot of them, we get back on their feet.
Our goal at the Mental Health Foundation is for us to help you improve your life, for you to live a better, happier, and fuller life.
And as we end this edition of the SXM Daily News, the St. Martin Bankers Association would like to inform the general public of the following. Due to the COVID-19 measures, the opening hours of all banks have been changed to 8:30 a.m. to 2 p.m. This went into effect on Wednesday, March 25th, 2020. For RBC, on Thursday, March 26, 2020, Republic Bank, Windward Islands Bank, and PSB Bank, and as of Monday, March 30th, 2020, Orco Bank, Banco de Caribe, and First Caribbean International Bank. I'm Valerie Van Putten. Just a reminder that this and other programs are available online. Simply log on to stmartinmediacenter.com for viewing. And on behalf of SXM Daily News team, we thank you for watching and plan on meeting you back right here again on Monday. Do enjoy your weekend.